and welcome to this special edition of Jamaica Magazine. I'm your host, Audrey Williams. We have a wonderful lineup for you. Do not go anywhere.
Our pensioners are our society's backbone, and we want to make sure they are cared for. That is why the annual pension exemption and age relief exemption has been increased to $250,000 each. You have worked hard for your country, and we want you to have a little more peace of mind in retirement. Your government is caring for you.
The proceeding was brought to you by the Office of the Prime Minister.
There is a myriad of summer offerings for the young ones to participate in around this time each year. But if you have a child with special needs, the idea might not be as thrilling. Still, with the right help, you may be able to navigate this path with less anxiety. Associate Clinical Psychologist Marlon Simpson stopped by with some pointers of things to look out for as you seek to empower your child regardless of their special needs.
Welcome to Get the Facts, the show that gives you information on the latest topics. It's summertime, and among the usual activities is summer school. This may be a bit more easy or accessible if your child has no particular special need, but what about those children who do? Here's hoping that today's program will provide some answers for them. Today we're talking with Associate Clinical Psychologist Marlon Simpson. Now he's the director of Loving Minds Associates and has worked with children with special needs for the past 15 years. Mr. Simpson is a certified autism spectrum disorder therapist, and he specializes in neuropsychology, working with children and adults on the spectrum. Welcome to the program, Mr. Simpson.
All right, thank you. Thank you very much.
All right, let's jump right into getting some facts here. Now, summertime, summer school, parents are looking for an appropriate program. My child has special needs. In your experience, what are some of the greatest challenges parents with children of special needs face in finding and selecting an appropriate program?
Usually, two main issues. One is finding persons who are trained to deal with children with special needs. So it's not just somebody who has a summer school and can do that.
So send them come.
No, that's not how it works. And so one of the other things that's going to be important is having even teachers who understand each child, what each child's need.
Right.
So even two persons with autism, for example, autism spectrum, they may have two different presentations. So we want to ensure that each child is catered to carefully in these programs.
So the method to address, especially even that last one, is invest in trained personnel.
Right.
Not just people who are willing, but actually trained.
Trained, right.
Okay. All right, so what about the common needs? Now, I know that this isn't an exhaustive list, but you've mentioned autism, so let's use that as an example. What are some of the common needs or challenges that children with special needs like that might have when it comes to a summer school or a summer camp environment?
All right, so a lot of children on the spectrum, so autism spectrum, usually have sensory challenges. So either they are very sensitive or they need stimulation. So you'll find them either hitting their heads or they're covering their ears because something is too loud. So it's, again, understanding the child, what's happening with him or her, and then working with them. But in addition to that, you have to understand that a lot of them also act through instinct. So you can't just treat a child on the spectrum as any other child and expect them to behave in a particular way.
Right.
So it's understanding them wholly and solely, individually.
I like how you said that a while ago, and the training comes back into play very heavily.
Right.
Very heavily here. Now, okay, so let's talk about the activities then. What sort of activities or structure is useful for continuing this example, but perhaps you can broaden it a little bit for children with common special needs as we know them?
All right, so another example would be children who have attention deficit hyperactivity disorder. So some may not be able to sit still, some lose attention very easily. So finding a program where If a child can't sit still, allow him or her to run up and down for a little bit.
And
get
that's
rid
the
of some of the
program.
energy. That's the program.
Ah, yeah.
You know, engaging them. But again, it comes down to the training. Who are the persons there? Can they handle these kinds of behaviors?
Right. Yeah. Okay. And, you know, I'm very curious about the strategies that these programs, you have to, in formulating a program, you have to think about all of this prior to the program, don't it?
Right.
It can't be an underground.
Oh, no. No. So the person who is doing the training or working with children with special needs has to have a background in understanding children with special needs.
Right.
But also coming to the fore is the thought that you have to engross yourself in the situation, understand the children. And so the programs are going to be defined or coordinated around these special needs. So, all right, so if you're going to be dealing with children who have autism and ADHD, fine. You want to have things where there's ample space.
Yes. Okay.
Play areas. You want to have areas where children can just express themselves freely. If they want to scream, let them scream. If they want to shout, let them shout. And not try to control or have too strict a set of curriculum guidelines to go through, per se.
Right.
Right.
And we've been talking about the trained personnel, and I know that some schools and camps, maybe even most, would have a mixed population. Maybe they're not all specialist schools. What ratio would you say trained personnel need to be in these schools? Like 1, 2?
I would say maximum 5 to 1. So 1 teacher to 5 children with special needs.
Oh, okay.
Because of the range of situations that you're going to encounter. So if we go back to autism, for example, there are 3 levels of autism. So one that's closer to what we call neurotypicals. They can go in regular schools. They just have problems with communication and speech. You have level 2, a little bit more challenges. Level 3, severe.
Yeah.
So even in that, it's figuring out who do we pair, how do we put the different children together.
Okay. Yeah, I firmly believe that you're giving some summer school teachers who are watching right now a lot of good info, you know, maybe things that they hadn't thought about before. But let's talk from the provider's perspective. How do I, when formulating this program, how do I judge success? You know, by what metrics should I be looking at to say, hey, this was good for them and useful?
Funny enough, I think that parents should be involved in some of these programs as well. So you don't just send the child and then you pick them up at the end of the day. It's, let me see what some of the activities are. Let me see how my child is responding.
Be there.
And engage with the teachers as well. You know, so some of the curriculum activities could involve the parents as well. So when the parents go home, they can say, I can continue what my child learned in summer school at home.
So the parents get a benefit from the program as well. Sir Simpson, we're about to take a quick break. Please don't go anywhere. We are continuing to discuss summertime special needs and what we can all do about this.
Keep that smile on their faces and preserve their innocence. Cherish the moments you have with them and create the best memories. Let's inspire our children to dream big and work hard to achieve all they aspire to be. Take the time to listen to our children and really hear their side of the story. Our children deserve love and the right to access their basic needs. Do your part and protect our children.
Welcome back. If you or someone you know has a child with special needs and is looking for a summer program, let us help you with your search. Associate Clinical Psychologist Marlon Simpson is here to tell us what to look for. Sir Simpson, jumping right back into getting some facts. Let's talk about a little bit more about the children now. How should I ask this question? How can we structure programs for these children in a way that it's not just a moment by itself, but actually works with pre-existing therapy or their pre-existing schooling? Is that something that we should be concerned about? And how do we address that?
All right. So if we, again, it's expansive, the amount of children with special needs, types of special needs.
Right.
So if we're looking at children with autism, they like structure. They like to know that the same thing, or there's a continuation. So I would say the summer school would have to get in touch with the regular school and say, hey, what are some of the things that you're doing, so we have a continuation of the activities. And then also engaging the parents as well.
Right.
Because structure is essential, even for children with ADHD as well. So how then do we allow for them to sit in class for 5 minutes, then get a 5-minute break, 10 minutes, then 5 minutes break?
So the general idea here then is it's actually not just an option, but quite necessary in any special needs to establish what has been taking place before.
Right.
On the part of the summer school. Okay, how can parents determine if a program fosters an inclusive environment? I'm looking at this flyer. And, you know how flyers are. You know, it tells you the date, the cost, and what should I look for that gives me a hint that, okay, this might be good?
You want to look at the persons who are organizing the event, or the persons who will be teaching.
Okay.
What certifications do they have in that particular area? If there's any information online about some of the work that this person has done. So you don't want to just take up somebody who has an interest in children with special needs and just does the course.
Yeah.
Right? So even the staff complement would have to include persons who are trained as well. So even they're from different disciplines, they have to have similar training.
Okay. Should I as a parent be concerned about things like the duration of the whole experience itself, days? You know, sometimes summer school is used as that time to take over the child while I can maybe go to work or something. Should I look at all those things, the how long classes are, you know?
Right, so that would be the second point.
Okay.
So the second point is, so once you know the person is certified and that they have the requisite training,
right,
then the person is expected to have a specific timeline which to work with the children. Usually the first day or two, so it would be flexible, I should say. So the first day or two, they're looking at, okay, the children that I have, are they managing the length of time? Is it something that we need to adjust as time goes by?
Right.
And then it would inform the parents. So having on the flyer itself saying, look, we encourage communication with our parents, so the parents are always in the know of what's happening.
Okay.
That's critical as well.
And I should look for a curriculum.
A curriculum?
I should.
Yeah.
Okay. This one is a question that's been bouncing around in my head for a bit. We could just not send them, right? But somehow it feels like it might be better to find ways to have them integrate. And what would you say to a parent who would be like, no, it's not too much work, better than just stay home? And should I actually want to do this?
Staying home is an option.
Yeah.
But you also want to gather as much information as you can. And so engaging your children in these activities, summer schools and all that, would be really good resource center for you. So the internet is good, but then having persons who are trained showing you techniques that you can use at home. How do I manage a child when he or she is tantruming? These are things that come out in summer school that you will be able to see and then apply at home.
It's a good investment, man.
Yeah.
It's a good investment. Sir Simpson, I don't know if you have any success stories that you could even give us the outline of. You have anything like that you can share with us?
All right. So I find that when I incorporate parents into the therapy sessions,
yes,
it usually goes a lot better. And I've seen a lot of cases where when I bring the parent in, they see how I work with the child or the children, And then there's this big sigh of relief, like, wow, I didn't know that this was even possible. So because of confidentiality, I can't share a story, but there are definitely situations where parents just feel this sense of calm, knowing that somebody really understands and is willing to work with children with special needs.
Yeah, you find that parents would be like, oh no, you can do that, but I can't. Is that true?
All the time. But then I say, let's switch roles. I'll be the parent, you be the therapist, and then I kind of guide them through the process of how to work with the child. And then they're like, oh, this isn't as bad as I thought it was.
I understand. That is wonderful. We're right in the tail end of this interview. There are parents who are watching who have children with special needs and perhaps might need encouragement that you are uniquely equipped to give. Do you have a final word for them?
My final word is, parents, come and experience it for yourself. Let us work together. I personally don't separate children from parents in therapy, as I said before. And so working with the parents, helping them as well, because they need the support.
Yes.
Their children take over everything. Everything, every discussion is about the children, but I ask the parents, how are you doing? How are you coping? And so working with the child, I'm also working with the parent as well. And they finally feel that sense of somebody appreciates what I'm going through.
And on that note, you've gotten some very good tips on choosing a summer program for your little ones this summer. Take key note of what Mr. Simpson has laid out for us. It is an investment that is worth it. This has been Get the Facts, and I'll see you next time.
Every student attending Heart and STA Trust under the New Care Initiative will get $15,000 each month to help cover their travel expenses to the Heart School they're attending and get an extra $13,000 each week while they're training.
The proceeding was brought to you by the Office of the Prime Minister.
Education, the key to a brighter future. The government means to equip our children with this key through its Transforming Education for National Development TREND program. Watch to learn more.
In a globalized world where nations must empower their people to become innovative citizens, Jamaica is ready to set the trend, transforming education for national development. Led by the Ministry of Education and Youth, the mission is for a brighter tomorrow. The 2021 Patterson Report made it clear, we need to ensure better quality education throughout all levels of the system. While the Ministry will lead the charge, we need all stakeholders to get into position to help Jamaica become a more globally competitive nation. Students, educators, parents, civil society, business people, media and communities. Jamaicans across all sectors can play a role. The journey to a brighter tomorrow starts now. Deliberate action is being taken on 7 strategic priorities up to 2030. 7 pillars of change to transform education. Better governance for better outcomes. Efficient spending and enhanced strategic focus. Improved and equitable access to quality early childhood education. Improved quality of teaching and curriculum delivery. A higher education sector that is coherent, equitable and well-resourced. Developing critical thinking, lifelong learners who are creative, innovative and productive, contributing to the country's sustainable development. Technical, vocational education and training built into the secondary level to support the development of entrepreneurial skills. World-class facilities and infrastructure in a technology-enabled sector and increased access at all levels of the system to equitable and sustainable funding. These are the 7 keys to unlocking our next level of exceptional learners and critical thinkers. With a lifelong desire to learn, Jamaica's youth have the power to not only elevate their own standard of living, but also to enhance the well-being of all Jamaica. As we push forward with TREND, we will create educational systems of success, assigning the best people to manage the process. Give more attention to early childhood education so we can stimulate excellent learner performance from the start. Empower our educators to create learning experiences that transform minds and lives for greater impact. Build an aligned network of tertiary learning institutions focused on delivering accreditations that strengthen the impact of our tertiary graduates. Provide physical and technological learning spaces that deliver equitable access and resources to all types of learners, and optimize educational budgets and resources to guarantee greater results from early childhood to tertiary level learning.
So that Jamaica may under God increase in beauty, fellowship, and prosperity, and play her part in advancing the welfare of the whole human race.
Let's trend so Jamaica will continue to be prosperous and more globally competitive. Trend, transforming education for national development, changing minds, changing lives for a brighter tomorrow.
Whatever illness you might have, it is important to visit the doctor at the earliest sign of sickness. For many conditions, early detection can lead to better outcomes. Don't stay at home and self-medicate and allow your condition to worsen before going to the doctor.
If you are a youngster, young child, 14 and younger, older person, or you have a compromised immune system, you have an underlying illness, a cancer patient, a diabetic patient, then your system is compromised. You need to see the doctor quickly and let the doctor prescribe.
Visiting your doctor early protects your health, so you can enjoy more moments, more life.
Let's visit the doctor, where urologist Dr. Belinda Morrison shares useful information about the prostate.
So the prostate is a gland only found in men. And it's a very small gland, present even from a boy is born, but increasing in size as they get older.
The prostate is located below the urinary bladder in the pelvis. It's behind that lower bone in the pubic area called the pubic bone. Right in front of the rectum, that's where you'll find it.
It wraps around the urinary passage, that tube that's called the urethra. It's very small. People talk about it being the size of a walnut. If you know what a walnut is, it's quite small, but increasing in size exponentially as men increase over the age of 40 years. Now it has a function, and we say in broad terms it's an accessory gland of male reproduction.
It aids in the reproductive process by forming approximately 20% of the fluid found in semen. Now, you can live healthily without a prostate, but in its absence, you would not have normal reproduction functions. It's important to note, though, that prostate health is threatened by several risk factors due to lifestyle choices and just life in general.
So there are three major conditions that tend to affect the prostate gland. And I like to say that there are three major conditions, not only cancer, because men like to say, I have prostate, and in their mind they mean prostate cancer. But firstly, all men have a prostate. And prostate cancer, yes, is one of the common conditions affecting it, but there are others. And probably even a little bit more common is an enlargement due to age. We call this benign prostatic hyperplasia, or BPH for short. There's also an infection or inflammation that can affect the prostate. We call that prostatitis. So anything saying itis refers to inflammation. So this condition leads to pain either on urination or pain in the lower area overlying the bladder, or pain in the back, pain in the testes. It can make the man have blood in his semen sometimes, even blood in the urine. There are different types of prostatitis. There's an acute type that may be associated with a fever, chills, sweats, rigors, which needs to be treated emergently. Or there may be a chronic type where the man has this chronic pain and chronic urinary tract infection. Every time he does a urine test, it shows that there's an infection there. Or there may be no bacterial infection, but there's just inflammation and pain, for which he may need anti-inflammatory medication or painkillers. Now, BPH, or benign prostatic hyperplasia, seen commonly in men over the age of 40 and increasing with age and prevalence, may result in two major types of symptoms. There may be symptoms in trying to get that urine out. So the flow may be weak, or the man may get the urge to urinate, but when he goes, he has to delay or wait, or he has to strain, or he feels like everything is not coming out all at once, or they may be the symptoms related to being able to hold the urine, where he may find that he's going very often, daytime or night, in the nights it wakes him up a lot. Or the worst or most severe thing is that he may not be able to pass urine. We call that in Jamaica stoppage of water, but it's really urinary retention. Prostate cancer separately may have no symptoms at all, but only detected by doing the blood test. Some people think that if someone develops prostate cancer, it's unlikely to cause death. Well, I'll tell you, for the last maybe 60 years, the Jamaica Cancer Registry here at the university has published that prostate cancer is the leading cause of cancer that we see. And the data that we have on cancer-related deaths suggests that prostate cancer is the leading cause of cancer-related deaths in this very country in which we live.
These conditions will not only affect the physical well-being of the individual, but certainly their mental health. In the case of BPH, having to urinate frequently will affect one's quality of life and even their profession. Seeking treatment is a must.
So the treatment for benign prostatic hyperplasia starts with medication. So there are medications that we can give you that can improve urine flow by simply relaxing smooth muscles within the prostate and at the neck of the bladder. And there are medications that can actually reduce the size of the prostate. And those two groups of medication can be combined and give men good, long-lasting effect on flow rate and improve their lifestyle and their quality of life.
There are instances in which a patient may not respond to medication. In these cases, minimal invasive surgery is pursued.
So we, rather than cutting, what we do is go in endoscopically through the male urethra that runs through the penis, and we resect the prostate. And this is something that is done under anesthesia. It's called a transurethral resection of the prostate, or TURP for short. Now, there are other newer, minimal invasive approaches for treating an enlarged prostate that may not require general or spinal anesthetic, may not require time in an operating room, and can be done in an office setting to simply ablate the prostate, whether it is with high heat or water jets, you name it, they're coming up with them. And I think in the last 5 to 6 years, more technology has come up to surgically treat an enlarged prostate than ever before. And I think these are good because it avoids anesthetic risks, it avoids hospital time, and people can get up and back to their normal lifestyle sooner than later.
Having regular visits with one's doctor should be a calendar event.
And I think in doing so, what you're going to do is have an increasing number of cases, obviously at first, but over time you find that the stage of cases diagnosed will reduce and mortality will be cut short and people live longer lives. So there's a definite benefit.
We have come to the end of today's show. To catch a repeat of this or any other, feel free to log on to our website at www.jis.gov.jm. Until next time, I'm Audrey Williams. Do take care.
This has been a production of the Jamaica Information Service, the voice of Jamaica.